Page 1. International Textbook of Diabetes Mellitus. Preface. As the epidemic of diabetes continues to expand in parallel with the rapid spread of obesity, healthcare providers strive to find interventions to reduce the morbidity, mortality, and rising costs associated with this devastating disease, which ravages both the micro and the macrovasculature. Although the increase in incidence of type 2 diabetes may be attributed to the expanding girth of the population coupled with a lack of physical activity, the marked increase in the incidence of type 1 diabetes remains unexplained. Our knowledge of the cellular, biochemical, and molecular etiology of impaired insulin action and beta cell failure has expanded enormously, but the genetic basis of both type 1 and type 2 diabetes and their associated complications is still by and large undefined. Despite the introduction of multiple new classes of anti-diabetic agents for the treatment of type 2 diabetes, and newer insulin preparations, insulin delivery systems, and glucose sensing devices for the management of type 1 diabetes, glycemic control is suboptimal in approximately half of all diabetic patients and the excess risk for macrovascular complications is largely unexplained. In many parts of the world, these treatment advances are not available and instituting behavioral modification programs at the societal and individual level is proving to be inadequate in curbing the growing epidemic of obesity. Whether the introduction of novel weight loss medications will stem the tide of obesity remains to be determined. The fourth edition of the International Textbook of Diabetes Mellitus will continue to be the most widely referenced textbook of diabetes worldwide and draws upon the expertise of leading basic scientists, clinicians, educators, and healthcare professionals globally to provide the most updated information on advances in diabetes research and clinical care. This information will be an invaluable resource and provide the practicing physician, as well as the basic scientist and clinical investigator, with the requisite resources to advance them to the frontiers of biomedical research in the fields of diabetes, metabolism, and obesity and to provide them with state-of-the-art knowledge to optimize clinical care for their diabetic patients. Ralph A. DeFronzo, M.D. Page 1.